I have the pleasure of introducing our keynote speaker of the hour, Councilwoman Pierina Sanchez. Mrs. Sanchez represents the 14th Council District, which includes the neighborhoods of Kingsbridge, Fordham, University Heights, Mount Eden, and Mount Hope. Mrs. Sanchez is an Afro-Dominican daughter of immigrants and born and raised in the Bronx. She began her career in public service in the summer of 2007, and it has propelled her into a career in public policy and urban planning. From the community board to the White House, and from work and advocacy organizations to the mayor's office, Mrs. Sanchez has been a fighter for immigrant families, racial justice, affordable housing, and good jobs. Now I'm going to add this. I didn't have this on my paper. I couldn't believe that that was her. You know, I thought, well, she's in school somewhere. Anyway, well, no, that's her. We welcome Mrs. Sanchez, Councilwoman Sanchez. Thank you.
Thank you, Dean. And see, what the trick is that you don't let folks get too close, because then they see the grays and then they get onto you. So good morning, everybody. Good morning. So thank you to Lehman College, especially President Delgado, Jasmine Clavesquin, who got me here, Marks Payne, and our dean here. I just want to thank you for inviting me to this important discussion. It's always a little surreal when I'm invited to be a part of events that have speakers that I've grown up listening to and watching and reading and learning from. And so it's really an honor to be in the presence and in the company of so many folks that will be a part of these discussions in the next 2 days. So as the dean mentioned, I'm Pierina Sanchez. I represent the Northwest Bronx. That's 170,000 people in our community who are 45% foreign-born and increasing, especially at this time when the city has received and welcomed more migrants coming in from the southern border and many borders, right? The global south, really. And for me, I come from a family from the Dominican Republic. They came in the late 70s, a family of resilient women, men, hardworking people, street vendors, who have dedicated their lives to making sure that their hard work, their sacrifices, their journey to this country was one that would open opportunities for their kids and grandkids and beyond. And one of my earliest memories here in the Bronx is of waking up in the middle of the night to the strong smell of smoke, screams, a fire that was actually my very first experience of tenant harassment. See, we lived on 183rd Street, not too far from here, and we lived with a landlord that didn't offer heat, hot water, didn't make repairs. We had rodent infestations, vermin, all kinds and manner of things that you shouldn't be living with in an apartment. And my mom, who is amazing, and my tias, who lived in the same building, they came together and they said, you know what, we can do something here. They marched over to 161st Street, talked to the Legal Aid Society, and they learned how to file an HP action, withhold their rent, and what they got in response was a landlord that retaliated. And 30 years later, it hits differently to be on the New York City Council, to come from a family that came up on public assistance, that are street vendors, that in the Dominican Republic, lived in ways that were very difficult. And to be here today, to be an elected official, but not only an elected official where I was born and raised, but to be the chair of the Committee on Housing and Buildings in the New York City Council, which is one of the most powerful committees regulating the real estate industry in our city, it just hits differently. It hits differently when there's a fire in the community because someone had an e-bike that caught on fire because they need the e-bike to get to work. It hits differently when there's a fire that takes 17 lives of Bronxites because someone had a space heater because they just wanted to be warm. It hits differently because it's personal. And for me, that is the link to the community-based participatory research that you all are going to be discussing over the next 2 days. And that link is the value of the personal, the value of the interpersonal, the value of community. For me, going through my career, first when I finished college and I came back to work for the New York City Council member, whose seat I now have, there was an instinct I had about the value of my experience and what we went through as a family, the fires, the evictions, the hardships, and knowing both on an academic level, reading books and papers and writing papers, knowing and understanding that my story was tied to stories that don't most often get told. And then bringing that into the city council and being a director of constituent services and sitting with person after person, 1,000 in total within a single year, who were facing housing insecurity, who were facing food insecurity, who had children who they had trouble navigating through the school system. And understanding that it's not about me and it's not even about those 1,000 people, but it's about the power of their stories to illustrate what we see in the data that we collect, whether it's census or surveys or anything else. And so that instinct drove me to policy school. It drove me beyond to the further steps in my career. And in policy school, I focused on urban planning. And I had this knack that was born and raised into a community facing housing insecurity, went back to work in the community, biggest issue is housing insecurity, went to public policy school, and really before that didn't understand urban planning to be a career, didn't really know about it except for, well, I don't know if folks are a little younger than me now because the grays are hidden. But there was this game called Sims where you would make cities and you would, decide where you're going to put the train, where you're going to put the school and all of that. And so that became what I studied, and that became my career. And in focusing on urban planning, when I graduated school, so 2 years, after graduated, I wasn't ready to let go. I wasn't ready to let go of academia. I wasn't ready to let go of learning full time. And so I went to work at a think tank. I worked at a think tank called Regional Plan Association, which is a 100-year-old organization that has been developing regional urban plans for New York, New Jersey, and Connecticut over the last 100 years. And the way that they work is that they produce regional plans once in a generation. So the first one came out in 1928. You might imagine what that one was like. The second one came out in, Great Depression, in the aftermath of the Great Depression. The second one was in the 60s. The third one was in 1996. And the fourth one, which I was a co-author on, was in 2017. And the thing about urban planning, and the thing about academia in the United States, and power differentials, and representation of voice, is that there aren't migrant stories in there. There aren't people of color who are at the table. And so when I joined RPA, I joined as a researcher. I was supposed to focus on property tax rates. Ford Foundation gave a very big grant to RPA to make sure that this time around, when they produce a regional plan that would determine or help determine the physical development of the tri-state region, that there were community voices represented, that there were underrepresented voices in the mix. And it's consequential because in the first regional plan, there were ideas there, like there should be a bridge that connects northern Manhattan to New Jersey. George Washington Bridge. The second level, the lower level, was supposed to be transit, by the way, fail, that is highway, but it was supposed to be transit. But in that regional plan, there were also ideas about parkways that connected in addition to highways. So the Merritt Parkway, what became Connecticut 15, those were all ideas that were born in the regional plan. And then after the Depression and the stimulus funds, that came after the Great Depression, after the World War, these projects were ready-made. And so going to an organization that has that kind of influence, that had it in the 20s, continued in the 60s, 90s, and to present, you want to make sure that the footprint that they're setting out for the region is going to be one that is inclusive. And so the Ford Foundation gave this $1 million grant to be used over the course of 2 years. And they attached some strings. They said, in order for you to receive this grant, you have to not only reach out to and do work in and try to solicit feedback from underrepresented communities, but you have to work with organizations that are deeply embedded in those communities, and you have to pass along the funding to them. And so of that $1 million that was supporting the research and the writing and the surveying and everything else and the mapping, a full $300,000 had to go to community-based organizations. That was Make the Road New York, that was Community Voices Heard, that was New York Communities for Change. You might recognize those from the New York City organizations, and they also have counterparts in New Jersey and in Connecticut. And so when we sat at the table, and right when I started, it was the very, very beginning of this process, we just gotten the grant, there was skepticism. And some of the representatives from the organization, I was the junior staffer, so I was, the one taking notes. But they straight up said to my boss, we're not going to be your token. We're not interested in this partnership, money or no money, unless we're going to have a real driving force and influence over what is written at the end of the day, over how you survey, over what your methods are. And well, I guess my boss didn't really have a choice because the Ford Foundation said we had to do it. It was an arranged marriage, but it was one that has really, looking back, I can do math, 7 years later, has really transformed not only the way that the regional plan was written, not only my own trajectory and career and how I think about research and writing and policy and the nexus between it all, but also how those organizations do their work, right? How they show up in policy spaces, how they advocate for housing, how they advocate for environmental justice. That was all shaped because of the collaboration that was forced upon us in, I think, a very good way. And so when we talk about and think about interdisciplinary work, collaborations across different spaces, there has to be a value on not just that as a researcher or as an academic or as the person who holds the pen or has the fingers on the keyboard that is controlling the spreadsheet, I have all the power and all the know-how, but that the individuals and the communities that you engage with are going to shape the way that you write, are going to shape the way that you formulate methodology, right? And it's going to change the way that you do your work. And so Make the Road and CBH and New York Communities for Change said, yes, we will work with Regional Plan Association that has been around for 100 years and that has been a part of the exclusionary planning practices and exclusionary outcomes of urban planning in the United States and in this region. We will work with you and we will shape your work. And so then we had a fourth regional plan several years later in 2017 that came out and was focused on equity, that was focused on health, that was focused on the experiences that are not always told. And I'm particularly proud. I was not only the person, my boss ended up leaving, I ended up running it. Sometimes when you're really good, by the way, you get punished by getting promoted and getting more work, not always getting compensated for it, but then you fight for that too, okay, fight for your compensation. And I ended up running the program, running the community engagement program, reaching thousands of people, but not just reaching thousands of people that they filled out my survey. No, these were town halls, these were buildings that we organized, these were, meetings on the ground. And I, for one, produced a report called Pushed Out, Housing Displacement in an Unaffordable Region, that looked at gentrification and displacement, not just in the 5 boroughs, but looked at it region-wide, used all kinds of census data, walk-up data, which is an urban planning data set, and I drove around the Hudson Valley. I drove around, southern Connecticut, and I drove around Long Island, going to people's houses and saying, can you tell me your story? You fit the profile in many ways for the average person who is at this income level, who is from this background. Tell me your story. What is it like? What was it like? And they told me stories about heating their homes with their oven. We've heard that, right? They told me stories about being $20,000 behind in rent and having no idea where they would go. They told me stories about doubling up, tripling up, quadrupling up in a one-bedroom. And those stories we know to be true. But to do community-based participatory research, to say, I'm not just putting numbers before you, but here's the story and the audio and the image of the individual that represents, that is powerful. And that shapes the research, that was my experience, but that also shaped the advocacy work that the organizations did. And so that stayed with me and is my orientation. We talk about community-based participatory research, but there's also community-based participatory leadership, community-based participatory governance, community-based participatory, whatever your lane is, you can do that. And so as a government official now, I have participatory budgeting in my office, which, if you don't know, is this crazy thing that no council members are supported to do. But we do anyway, if we want to empower our communities, where we as council members receive $5 million, no questions asked. Well, lots of questions asked, it's government funds. Let's be clear, no corruption here, okay? But we do receive $5 million allocation to say, these are the projects that the community needs. And what I do is I turn over $1 million of those dollars, and I just put it up for the community. We go to schools, we go to libraries, we organize harvest festivals at St. James, we organize lots of events and participate in lots of events, and just ask people, what's going on? Where are their lights out? Where are the parks subpar? Where do you feel like your children aren't safe because of why? And that way we source lots and lots of ideas, and then we call them with the city agencies, because there are a lot of rules about how you can spend government funds. And we end up with a list of projects that then the community goes back to the community for a vote. And it is a very difficult process. It's actually led by community leaders that we work with across the community, which we identified by asking folks, and the people who get most animated, they're like, you know what, you need, on 184th and Morris, and for years, and I've told everybody, and nobody will listen. I'm like, really? How would you like to be? And that's how you recruit the leaders in, right? They self-identify themselves. So we have a cadre of them. It's about 10 people every year, because I did it since my first year in office, and this is the third go-around. They call the projects with the city agencies. The projects get put before the community for a vote. And not only do community-based, community-supported projects get supported, right? A gym renovation for this school that hasn't had it in 30 years, a playground over here. Not only that, but I walk away with a whole list of the community's priorities, and I know who wants them, how long, how feverishly and how necessary it is, and it informs the rest of how I can use the $4 million, or advocate for the mayor and to the speaker to receive more funds in our community, which is a high needs one. And so all of that to say is that we all choose different lanes. Different lanes are going to speak to you. You might want to work in direct service. That might be your calling. You love the one-on-one, and you feel like you can have an impact on an individual's life and a family's life, and that is the kind of impact you want to have. Thank you, that is so important, and that's a lane. You might choose to, you might be a bit of a person who likes to be in front of a computer, who really likes numbers, who likes to manipulate information and understand and learn lessons from data. Thank you, we need that too. And you might be someone who likes to jump in front of mics and talk a lot, and that's okay as well. And so public sector, private sector, wherever you end up, it is so important that you do your work, first and foremost, with an orientation centered in values, an orientation that is uplifting those that need voice the most and that need representation the most. You can integrate everyone into your work. And with that, thank you so much. I look forward to a productive conference, and thank you for inviting me today.
Thank you, Councilwoman Sanchez, for your intervention. It certainly sets the tone for our next presentation. So our next presentation is going to be led by the affiliated faculty at the CUNY Institute for Health Equity. This includes myself, Maria Isabel Roldos. I am the director. Jay Jones, Dr. Jay Jones from the Office of Student Affairs, and also an affiliated faculty. She also serves as the Community Engagement Associate Director. And we all have a stellar student working with us who's a recent graduate from the GSI in Public Health program, Mrs. Jocelyn Rajabayali. And we were going to be presenting the findings of one of the early research projects that we did by serving a data call on CBOs across the Bronx using a methodology based on strengths-based assessments. We knew CBOs had a lot of needs, and the literature is flooded with those needs, but we really wanted to have a different approach of community-based work that would inform later our community-based participatory initiatives, looking at from strengths-based assessments. So with that, I'm gonna invite my co-presenters to this table so that we can go on with what we are calling the Bronx Health Collaborative Initiative and present to you all as well the results as well as the next steps of that initiative.
I guess I'll start up here. Yeah.
All right, good morning, everyone. Good morning. Dr. Jay Jones, currently in the role of Student Affairs, but have worked with Dr. Roldos for several years on this particular project, and very happy to talk about our work. Just briefly, we have talked a little bit about the CUNY Institute for Health Equity, but I just wanted to reinforce that this is a CUNY-wide institute that coordinates research, teaching, service, community engagement around health inequalities, reducing health disparities, and promoting health. In 2021, the CIHE, as we call it, embarked on a strategic plan process that redefined its missions, its goals, and its actions for the next 5 to 10 years. And there was a core group of faculty, undergraduate and graduate students, and community partners that helped us with that process. So why the Bronx? One reason is, as an anchor institution, Lehman is really committed to supporting the community that it's located in. But the Bronx is also a place where there are a lot of health and social challenges, and some of those have been exacerbated by the pandemic. You've probably heard that the Bronx is number 62 out of 62. The county health rankings and roadmaps has consistently identified the Bronx as the least healthy county in New York State since 2010. So there's the highest rates of chronic diseases like asthma, diabetes, hypertension, obesity, and tobacco use disorder, and then also challenges around violent crime and environmental contamination. The Bronx was also disproportionately impacted by COVID. Though it didn't have the highest infection rates, the outcomes in the Bronx were much more severe, with the highest hospitalization and death rates. Despite this, though, the Bronx is a place where there's been a history of collaboration, grassroots advocacy, and opportunities for people to thrive and be effective in these collaborations. Community-based organizations have joined public health agencies, churches, work with public funders and healthcare services, which are centered in the Bronx, to face a range of these health and social psychological challenges. So it's not all bad news. This is a place where collaboration has been able to thrive. And as the Councilwoman discussed, community-based participatory research is really a big part of our work. We use it to help guide the work of the Institute because research has made it clear that this approach can really help CBOs be engaged in fruitful partnerships with academic institutions like Lehman to improve the health status of communities. And we're really drawn to it because it recognizes the community as a unit of identity. It builds on the strengths and the resources of the community, which is very critical, promotes co-learning among partners. It also looks at the mutual benefits between science and the community and emphasizes the relevance of community-defined problems. There's also a collective process for developing how to approach these issues and maintain the partnerships between the community and the researchers. And importantly, the research is always disseminated to the larger community for discussion and analysis. Also, this is a best practice in many ways for promoting the widespread adoption of evidence-based programs and interventions. So when you start with the community, have the community be engaged in developing the methods and then share that information, it's much more likely that the adoption of these types of programs and interventions will be successful. So as I mentioned, there's been a long history of collaboration in the Bronx. We're building on that history in our work. These coalitions and partnerships are not only about emphasizing community, but also the grassroots nature of a lot of the advocacy and work that's done at the Bronx. And they pay attention to what we call the social determinants of health, things like education, access to accurate information about health-related issues, unemployment and job insecurity, food insecurity, housing and the environment, and also access to affordable health services of good quality. And all of these things have a major impact on people's health, well-being, and quality of life. So there's coalitions like the Northwest Bronx Community and Clergy Coalition that was really important in addressing the crack cocaine epidemic in the 80s and 90s. Department of Health and Mental Hygiene has also been involved, especially around COVID-19 and flu vaccinations and providing information and knowledge to the community. And also more recently, coalitions that have formed to support immigrants moving into the Bronx and that have worked closely with faith-based organizations to make sure that these new members of the community know about infectious and chronic diseases so they can prevent them. So our study utilized what is called a SWOT-SBA, or a Strength, Weaknesses, Opportunity, Threats, Strength-Based Assessment to evaluate CBOs. This was a qualitative approach that focused on the CBO strengths. So what the programs, the activities or services did the organization think they did best? Their weaknesses, or what we framed as areas for growth. So what an organization felt they needed to grow their strengths. Opportunities, specifically where organizations can use their strengths to fill the gaps. So how can an organization take advantage of changes? And then threats. These were obstacles to growth or utilizing their strengths. So what changes, for example, in an organization's field of service could potentially threaten their future growth or success? This was obviously very aligned with the CBPR focus, building on strengths and also the resources of the community. In addition, we collected descriptive information on CBOs, catchment areas, services that they provided, and their population served to create interactive and static maps. And my colleague Jocelyn will talk more about those. So I'm going to talk a little bit about our results with the SWOT-SBA. We sent over 200 invitations to complete a survey or a questionnaire with the help of a community convener from the Bronx. And we had a total of 44 CBOs complete the contact information, 36 the contact information and the services, and then 34 completed the SWOT-SBA sections. So I'm going to talk a little bit about what we found in terms of that data. In order to examine or evaluate the data, we used thematic analysis, which included an identification of recurrent words and phrases, and then an assignment of labels to those to represent recurring themes in each of the SWOT-SBA categories. So in terms of strengths, we found that organizations provided a range of services that they felt were reflective of their strengths, including those that address things like basic needs, so housing and food insecurity, focused on community engagement like advocacy, and also on programming that supported the educational, social-emotional, or health-related needs of adults or youth that they served. Areas for growth or weaknesses centered primarily on capacity building, so the need for additional financial supports, personnel, and physical space. They also identified the need to build their fundraising skills and improve their ability to communicate and market their services to their community. COVID-19 had really impacted the capacity for these organizations to provide services, but some of them noted that it also had brought additional attention to some of the challenges that the community had faced, which they felt could bring in potentially more funding. So this was in some ways a type of opportunity. Other opportunities identified were the expansion of services, encouraging collaboration and capacity building across CBOs, and providing more virtual and online services, especially among the groups of people that were facing the most challenges. And these concerns for many of the CBOs were linked to the intersection of basic needs, health equity, and racial and economic justice, which the disproportionate impact of the pandemic had really heightened in the Bronx. So as a result, CBOs were really doing their best to work with one another and to expand and deepen their impact. And finally, threats or obstacles to growth. And these included limited physical space and funding, staff shortages, limited access to technology, and those things really impacted the ability to provide services, to expand, and also to build those collaborations. And at the time of the survey, the range of COVID-19 mandates and policies on masking and air quality had also impacted or tested the organization's abilities to adequately serve the community. Next up is Jocelyn. Thank you.
All right, good morning, everyone. Sorry, just give me 1 second. Okay, so I'm going to handle the maps. Basically, we wanted to do something with all of the data we collected that would tell an effective story, not just for our benefit, but also for the community's benefit. And maps are a great way to tell stories visually. So we created a great selection of maps as well as an interactive map that we will be demoing in a little bit. So the first map we created was a map that shows an aggregation of how many community-based organizations are serving each community district. So on the survey, each CBO was allowed to select multiple districts. So it wasn't mutually exclusive. A CBO could say that they served, for example, both Community District 10 and Community District 11, even if their main location is only in Community District 10. So as you can see on the map, Community District 2 was most represented with 14 to 18, I believe it's 18 organizations in Community District 2. And then the community districts in red had the least number of organizations serving them, which was 9 to 11. So we also created some tables to show the answers to the survey questions about services being offered, as well as the populations that the community organizations serve. So in this table, you can see the different types of services that the organizations are offering, from counseling services, education and training, housing services, health services, et cetera. I just want to draw your attention to Community District 8, which seems to be experiencing some gaps in services compared to the other districts. Community District 8 has five services that are not represented by any organizations. And I also want to draw your attention to the primary care health services, which were only being offered in 3 different community districts out of the 12. And again, community organizations were allowed to select multiple services. This wasn't a mutually exclusive question. So community organizations were also allowed to identify which populations they serve. So this question was asked in 2 separate parts. They were asked for general populations, and they were also asked about health disparities focused populations, which are populations identified by the National Institutes of Health as populations that are at a higher risk of facing health disparities. So most of the community-based organizations selected adults as their served population. Women, children, adolescents, and young adults were also well represented. However, if you look towards the bottom of the table, you can see that veterans, the elderly, the homeless, and the LGBTQ+ population were not as well represented. For the health disparities focused populations, racial and ethnic minorities was a common choice by the CBOs. However, underserved rural populations and people with disabilities were not well represented. I just want to note that people with disabilities is a recently added focused population by the NIH, so the hope is that now that it's becoming more recognized, that more organizations will begin to offer services for that population. So after going through all of this data, we decided that we wanted to create a tool, not just for us to be able to explore this data along with census data, demographic data, environmental data, but we also wanted a tool where the community organizations and just regular members of the community would be able to have free access to this data, because having access is, they would be better able to kind of get an idea of what their community needs, and having access to that type of data is very empowering. So we created an interactive map, and this is a live demo of it. I'm just going to talk you through it. So this is available on the Institute's website. We have a navigation guide where you can click and kind of see the tools available and how to use the map effectively. So the really amazing thing about this map is that everything is live. It's all updated live. We have all of the locations of the surveyed organizations. You can click on each pin and information about the organization will come up, the address, the phone number, what populations they serve, what services they offer. So it's a really, really powerful tool. And as you can see, I mean, it has everything listed here. And you're also able to search by location. So it's going to pop up right now. You can, for example, if you live near Lehman College, you can type in Lehman College. Once you click it, it should zoom in, and you'll be able to find any organizations nearby. There is one nearby in Kingsbridge, and again, you can see all of the information about what they're offering. So we also have the ability on this map to filter by the populations that are served. So for example, if you identify as an elderly person or a veteran, then you would be able to filter all of the organizations by whether or not they identified themselves as serving that population. So as you can see right now, as the filters go on and off, the organizations disappear and reappear. So this is a great visual, like I was speaking about before, where the elderly population is not well represented. See how many organizations disappeared when you click that filter. The same for the LGBTQ+ community and also veterans. So besides the survey data that was collected, we also wanted the ability to see this data along with other demographic information that's related to determinants of health. So we have the ability here to turn layers on and off. So right now it's showing a layer that shows the race and ethnicity estimates per census tract. As you can see on the bottom, we have a legend that explains the colors for each race or ethnicity, and it shows that 1 dot equals 70 people. So right now on the map, you can kind of see that a lot of the map is green. There's a very large Hispanic population in the Bronx. So we also have the ability to turn off each category and only see one category at a time. So as you can see, each one is turning off, and you can get a better idea of where these populations are located instead of having them all on top of each other. So we also looked at some other demographic data from the census, for example, median household income. This was very interesting because, as you can see, I believe this is Community District 8, which is Kingsbridge, the Kingsbridge area in Riverdale. So you're able to also click on these census tracts and see the information. The median household income in this census tract is only $31,500, and that's an estimate. Whereas probably a 10-minute drive away, the median household income jumps up to $104,000. So that's very interesting, and you see that there are multiple organizations in that district. So it would be interesting to see, hey, there is this disparity between income. What types of services are these organizations offering? Are they offering housing services, employment services, et cetera? So we also added, and I'm sorry if I'm speaking too fast, we also added health data. So this layer shows COVID vaccination by zip code, and that data is in the process of being updated, but again, something that is very important for community organizations and community activists to have access to. We also added environmental data. So this is a layer showing the air quality. I'm sure you all remember this past summer, we had a lot of issues with air quality due to the Canadian wildfires. So we thought that this layer was also a great educational tool for the community. We also have a heat vulnerability index. So the darker colors, those are the districts that are most at risk for hazardous effects due to severe heat. And we also have things like hurricane evacuation zones and I believe educational attainment and other demographic data. You also have the ability to see descriptions of all of these layers. So if there's anything that you don't understand, this one is for the air quality index. If you want more information about where the data comes from, or just an explanation of what types of pollutants there are, you can click on that. And all of this can be accessed from the Institute's website. You can go to the main page and then click on Community Partners, and you'll have access to the interactive map as well as downloads of static, just print out PDFs of a selection of maps that show both the community organizations and all of the demographic and environmental data that we've included. So that is pretty much it for the map. The interactive map is continually being updated, so feel free to go in and check it out. It's an amazing tool. And up next, we have Dr. Roldos to talk about 2023 updates and also what's next.
Well, thank you so much, Jocelyn. And now that the nerves have, shaken off, I can be more candid. I can't stress enough how appreciative and how thankful I am for, the work that Jocelyn has done on these maps. Jocelyn's an undergraduate graduate. She did all this work with our guidance and single-handedly, so I cannot recognize her effort and work is strong enough. The work that has been put into these maps have been enormous. And it's forever guidance, forever meetings, forever trying to improve it and improve it. And we really take to heart the words that we had from Councilwoman Sanchez, is that community work really is about giving back to communities what is the work that we're doing. We can't just take out information and never return it back. And this is why we wanted the maps to be more public. This venue itself was an opportunity for organizations to come and see the maps personally, and if they had more feedback, more input of what was done, this was another venue for dissemination and feedback back to us. To the 2020, so the efforts that we did with that my colleague, Dr. Jones, presented earlier were between 2021 and 2022. We not only had a community, a Bronx convener who unfortunately left us too soon during the data collection, so I have to recognize his name is Gabriel Farias. He worked with us and unfortunately had a car accident, a fatal car accident, and that work was left undone. But we continued with the work, but I want to make sure that I recognize his work here today, as well as other students here. Erica Acevedo is here. She was part of this effort as well. And Andres Valcarcel, another student from this program of history. From the history program, Erica is from the Health Service Administration program, and Andres Valcarcel from the history program. We're also part of that effort. So now what's next, right? So what have we done with this work? So we've done many things. We verified all the data from 21 to 22 data call. We have systematized and presented all the findings in a journal and academic manuscript that is gets under review. We hope to get it published very soon, hopefully sooner than later. As you probably know, if it's not published, it doesn't exist. So we need to get all these efforts published, even if it's descriptive, but we need to get it as published as possible so that we can continue to build on. But while that process is under review, we wanted to do a 23-24 update on the data collection. So we have revised and streamlined the questions that we had from the 2021-22 effort. And we call it now the, initiated data call number 2 for a new cohort of CBOs. You will probably see outside, we have a flyer if you want to join the efforts today or during the conference. We will be giving out, it's just a click, you click the QR code and it directly takes you into the survey. The survey is very similar to the first version with some revisions to make it more easy. We streamlined the questions. We really took seriously how to collect this data. We started in summer 2023. So in summer 2023, we were able to collect information of 22 new organizations in addition to the 34 we already have. I think that with the information that we're collecting now, and hopefully this summit as well is going to bring us together with new partners, new organizations that maybe were not aware of the work that we were doing in 21-22. The Institute is still a newly invigorated institute, so visibility has been our mandate and our challenge at the same time. So I think by 2022, our goal is by 24 to put and conform the first community advisory board among the organizations that have shown commitment to the efforts that the Institute is doing and really inform what that community participatory research project will be. Without community organizations, a community participatory research project that would improve or address the health disparities or health inequities in the Bronx would be without a base. So we wanted to be as rigorous and as thoughtful as possible by collecting data and analyzing as we move forward to make it a strong proposal. So I do have some preliminary findings, and again, preliminary I can't highlight enough because we still we only done data collection in 2023 in the summer, and we, like I said, we're going to continue in 2024. But I wanted to share some findings. So I'm actually have to stand over here to do it. Because I can't see. So one of the findings so this is just some of the data that came out. So one of the organizations that we came out is we asked, what type of population do you serve? So we are starting to see in the second cohort a similar trend of what we saw in the first cohort, but we're starting to see that there is an increase on populations that are elderly compared to what we had in the other survey that Jocelyn presented, but definitely the same trend. We did ask about the health disparity populations. We still see a big trend of racial and ethnic minorities and socioeconomic populations with socioeconomic status. We went ahead and asked organizations what type of services they provide. This time around, it was the luck of the draw, or maybe it was the type of organizations that have maybe didn't complete the first one, now in the second data call, most of them said other. We don't produce any of these organizations. Could mean many things. We don't know what that really means at this moment. It could mean that our categories were too restrictive, or that really organizations are really going into an innovative way of what the type of work that they want to be doing. Migration, for example, we didn't include in that survey migration services as one of the categories to select. So we need to look at that other category more closely. But then again, this data caller really had a strong intent to look at what is organizations searching for partners for. What type of partner do they need? And overwhelmingly, they want partners to do advocacy. What type of advocacy is a conversation that we would have to have with organizations to see the advocacy that is needed. But 90% of the organization, these are not mutually exclusive, said they would need to support or would want a partner like Lehman or CUNY to do advocacy. But then again, for us, we are a research institute. We want the organization to engage to actually identify research as being one of their main interests. In this time around, we did ask organizations to please rank what do they think is the issues that are affecting the most in the Bronx, and you can see them there. So the bar lines are pretty telling of what they're influential. We asked them to rank them from 1 to 12. We used the Robert Wood Johnson Foundation in county rankings categories to select the health outcomes so that we can mirror and process that data in comparisons to the rankings data when we're ready to write up the results of this data call. So both of these categories mirror those outcomes as well as the causes as well as outcomes from the rankings. So you can see there in the left what the organization is starting to say that they consider to be the number one cause for health inequality in the Bronx. And over here, we can see what is the populations or what is the causes. So a lot of the causes have to do with adult diabetes, child asthma, intentional violence, continues to be the top categories where organizations are saying these are the health outcomes that we are the most concerned. Most of them organizations want academic partners, and I think this is my last slide. And we wanted to ask, when you're working with an academic partner, there's many roles for organizations to be part of. Not every organization has the same role. There are organizations that are willing to do advocacy, organizations that want to be participant in evaluation, fundraising, planning, data collection. So there's different types of roles that organizations can have. And as a research institute or in a higher education institution, we have to be able to, find the right spot that actually would work with the strengths of the organization. So we asked these different types of categories, and overwhelmingly organizations were saying that they want to do more promotion and dissemination of evidence-based practices. That was almost every organization that were asked wanted the opportunity to show our results, show our science, show our scholarship through their communities. And again, there was a few organizations that still wanted to be part of designing plans or goals or recruiting participants into trials. So there's different roles where, organizations have a role. So what is next? We have, like I said, an invitation to join this effort for 23-24. If you don't catch it here, we have a flyer outside in our signing tables so that you can join us for this new effort if you haven't done so already. And that's kind of like the presentation that we have on that study. Surely when the publication comes out, we will put it up on our website and make it available. That's part of that dissemination efforts. And that's all we have.